Hello everyone, this is Mrs. Ferguson, and we're doing things a little differently right now. I am encouraging you all to listen to this about patient education because a lot of what we're going to do in class on Tuesday, you're going to need to know this information in order to participate in these fun activities that I have planned. So I encourage you to listen to this. I know you have a lot on your plate. You're looking forward to Thanksgiving, but I promise it will be fun and worth it. And we're going to have a great time digging into patient education because I want you all to understand how important this is because you are going to be doing this a lot, and it really is a large role for the nurses for patient education. And we're going to kind of dig into that kind of on the brief side, and then you're going to implement what you've learned through this. We'll review some things in class and some role playing that we're going to do in the classroom. So I hope you guys enjoy this. I'm going to try to make it as fun to listen to as possible, but try your best to engage and just enjoy this information because as a future nurse, you're going to need this. You're going to need everything that you've learned and will learn. But this is very important. Let's begin. So you have standards for patient education. Believe it or not, the Nurse Practice Act actually recognizes that patient teaching falls within the scope of nursing practice. There's a lot of things that fall within the scope of nursing practice, patient education being a large one of them. We talked last week about Joint Commission. There's standards for this type of information for education in families. And you also want to make sure that you successfully accomplish these standards, not for you, but also for the patient. So with the standards for patient education, in all of this, your main focus is that a lot of this should be patient-centered, of course, right? And that you need to take into consideration what is your patient's own education, what's their experience, what is their desire to actively participate in any type of education. You're going to need to understand their cultural values, which we obviously learned a lot over your great presentations. Psychosocial needs, what are their spiritual needs that we need to consider when actually educating our patients. So what is the purpose of patient education? So you obviously want to help individuals, your patient, their families. You can impact communities to achieve their optimal levels of health. This includes maintenance and promotion of health, illness prevention, restoration, coping with impaired functioning that you will see a lot. You want to allow patients to assume more responsibility of their own health. They need to be responsible for what they're doing, and you can empower them to do that through patient education. Caregivers are going to need education about how to care for their family members, how to perform skills at home. You're also going to have to teach family members to help the patient with all of their care management, like I just said. But it's important that you understand the purpose of this education because, of course, that will impact the patient. So teaching obviously is giving knowledge through a series of directed activities. We know the concept of teaching. We want our patients to gain new knowledge. We want to change their attitudes about what their illness or changes in their life may be. We want to help them adopt new behaviors. We want to help them perform new skills. I've talked a lot about patients with diabetes. That is a huge impact on their lives. So when we teach them, we're going to be giving them a lot of knowledge, and we need to ensure that it is appropriate teaching and also something that they're excited about. So obviously learning is a process of both understanding and applying new acquired concepts. So the purposeful acquisition of new knowledge, you have attitudes, behaviors, skills. We talked about that a lot. But most importantly, teaching is most effective when it responds to the learner's needs. So if you are obviously teaching a patient about something they don't need to know about, they're going to not listen. So it's your job, essentially, to really understand what it is they need to learn and appropriately teach them and evaluate their learning, which we're going to talk about. So what is your role as the nurse? You have a big role. You're going to teach information that patients and families need. This is going to help them make informed decisions regarding their care. This is obviously very important. You need to determine what the patient needs to know, and you need to be able to identify when they're actually ready to learn something. You can't just teach a patient when you feel it's necessary. The patient needs to be ready to learn what they need to know, or they're not going to listen to you. Truly, they're not. So these are just some things I want you to glance over. This is the role of the nurse. So the Joint Commission, also known as TJC, is these are some speak up tips for the patient that they can do in order to really be involved in their teaching and learning. So review those on your PowerPoint for yourself. So you learned prior about communication. Teaching definitely parallels the communication process. So it depends partly on your interpersonal communication with the patient. It needs to be effective. They want to learn from you. You have different learning objectives in your mind which will be able to accomplish after instruction is given. For instance, I want you all to understand the role of the nurse in patient education after this. So I'm going to do my best to teach you that for you to be able to understand that concept. I want you to be able to understand and demonstrate education for a patient. But I can't expect that from you if I don't teach you appropriately. See the concept there? Effective communication also involves feedback. So I'm going to have feedback from you all when I teach you. You're going to need feedback from your patient through your teaching and patient education. You have to remember that we've talked a lot about the attitudes, the values, what are the emotions of the patient, cultural perspectives. What's the knowledge that they actually have? What are you trying to deliver? So some things I want you to think about is what are some examples of ways to evaluate the success of a teaching session. So for instance, if you were to be teaching something, what are some ways that you want to evaluate that you've actually taught them well or they actually understood the knowledge, such as demonstrating the skill. So if you've just taught your patient about giving themselves insulin, you want them to show you how to do it. That's a way to evaluate that they have actually understood what you've taught them. Or if you just taught them about their new medicine, they can tell you what you just taught them and be able to show you maybe some different ways that they can administer themselves their medicine. Make sense? Are you guys still following me? Don't zone out. I'm trying to make this super exciting. We are halfway there. So, domains of learning. I have to tell you, I have seen these so much in my master's program, and they're very important, which I never really realized during my undergraduate, but these are very important. There's different domains of learning. So you have your cognitive domain, which is more or less your intellectual behaviors, like your knowing. This requires thinking. So you have your affective domain, which is a lot of feelings, attitudes, your opinions, your values, and how you're going to learn. And you have psychomotor, which is like your doing. So skills that require your coordination. You need to integrate physical movements, mental type of movements that you're going to do. So those are different domains of learning so that you will see throughout your nursing career. So what are some basic learning principles? These are very important to know. You're going to need to know these to apply some knowledge during our active learning on Tuesday. So you need to address the patient's desire or willingness to learn. If the patient does not want to learn anything right now, don't try to teach them. You need to understand if they're desired and willing to actually learn the material. Otherwise, you're truly wasting your time. And it can be frustrating because it's a good time for you, but you need to be aware of what's the best for the patient, right? We need to do what's best and make it patient-centered. So we also need to understand what's their ability to actually learn. What are their physical and cognitive abilities? What developmental level are they? Where did they graduate high school? Are they children? Are they adults? How old are they? What's their physical wellness? What is their actually thought process? How are they able to actually learn? These are things you really need to consider with patient education. What's the learning environment? Allows a person to attend to instruction. So if you're going to put me in a cold room, I'm cold all the time. If you're going to put me in a cold room and try to teach me something, I will not listen because I am so focused on the fact that I'm cold. I also need a very quiet learning environment. So if you're going to have other people around me talking while you're trying to teach me, I will zone out. So these are things, we're going to get into some learning environments, but these are some things that you need to really consider in a learning process for the patient. So we talked about that. So again, I talked about the fact that children versus adults, how they're actually going to process the information, the ways that they're going to actually physically be able to actually understand what you're teaching them. So, motivation to learn. We've talked about this. We're going to keep talking about this. You have an intentional set, which is the mental state that allows the learner to focus on and comprehend a learning activity. I've told you over and over again already, I feel, that if the patient is not ready to learn, they will not listen to you. So, before learning anything, patients must give attention or concentrate on what information is being learned. So, are they physically uncomfortable right now? Do they have anxiety? Are there environmental factors that actually influence their ability to focus? So motivation is a force that acts on or within a person to cause the person to behave in a particular way. So what is their motivation to actually learn? Determine a patient's level of comfort. We kind of going on both sides here before beginning a teaching plan, and ensure that the patient is able to actually focus on the information. Assess for any anxiety that the patient might have. A lot of the times, if you're teaching on a new illness, they're very anxious about this. This is a change to their life. And this is something that you really need to focus on to understand their motivation to learn. If they don't want to learn, they're not going to learn. I've said this again. You need to assess their motivation to learn and what the patient actually needs to know to be able for them to comply, for them to be able to do what you've actually taught them. No therapy that you're going to do will actually have an effect unless a person believes that health is important and that it will actually improve their health. So they want to know that this is going to work, and you need to motivate them in that, and they need to be motivated. Make sense? I know this sounds, kind of duh, you know what I mean? But these are things that as a nurse you're going to learn really will affect the learning process in a patient. So more stuff on motivation to learn. So use of theory to enhance motivation and learning. I'm not going to go too deep into this, but there's different theories like the social learning theory, the self-efficacy, things like that can help an individual learn, help guide your instruction for the patient. Psychosocial adaptation to illness. So again, I mentioned, like, what if a patient has cancer? This is a big impact on them. And if they literally just found out 5 hours ago that they have cancer, they're still grieving that information. So if you're going to go in and try to teach them about chemotherapy, they don't want to know that. They need to grieve, to give them time to actually adapt to the emotional and physical implications of their illness. They need to go through the steps of grieving in order to receive new information. So, and also you have to understand that their readiness to learn is actually related to the stage of their grieving. They cannot learn when, again, they're unwilling or unable to actually accept the reality of the illness. So if they can't accept that they have cancer right now, they don't want to learn about cancer. You need to understand, like, where they want to actively participate and where are they psychosocially in this. So active participation, as it says here, implies an eagerness to acquire knowledge or skills. If they're not eager to understand and better themselves or deal with this, then don't try to actually educate them. They need to be motivated and on that page. So what is the ability to actually learn? So you have developmental capabilities that we've talked about. This actually influences the patient's ability to learn. So you need to know what their level of knowledge and what is their actual intellectual skill before beginning any teaching plan. So you need to understand that learning occurs more readily when new information complements existing knowledge. For example, if you're going to actually teach a patient how to measure food, for instance, measuring liquid or solids, you're teaching them of a diet plan. This actually requires the ability of them to perform mathematical calculations. So if they can't even begin to perform these mathematical calculations, how are you going to expect them to learn this new knowledge? So what is their prior knowledge? What is their foundation of understanding? So again, developmental capability. What is their cognitive development and what is their prior knowledge? So you also have to remember that you're going to teach kids. It's much different. In the emergency room right now, I teach more of the parents because they're not coming in for, like, for instance, teaching them on fever control. I'm not going to teach the child when to take their Tylenol and Motrin. That's not their developmental stage. That's not what they know. I'm going to teach the family about that. But when I do teach the parents, what do they know about measuring medicines? What do they know about Tylenol and Motrin? What is their prior knowledge and understanding? You have learned, Erickson's stages of life. You have understood the developmental stages that you need to understand for a child. How do they learn best? So you have many types of learning that can't take place without understanding this information and their actual ability to learn something. If I'm going to teach you my master's level information and you don't even know the basic concepts of nursing, that again, I have to understand how you actually learn and what's your ability. You have adult learning, so you have to remember that you have adults actually tend to be self-directed learners, but they often become dependent in new learning situations. So adults, obviously you as adults are self-directed in your learning, but if it's a new source of information, you're going to also depend on the teacher, just as you do now. Your nursing information is new, so yes, you're learning yourself, but you're also depending on your teacher to teach you the information as well. Very important here is that you need to make education patient-centered. You do this by developing educational topics and goals in collaboration with the adult patient. You just don't go in and teach something without having the patients in mind, without having the outcome be patient-centered. So you actually need to involve the patient in this information, of course, and what they want to know, like what is it that they need. So you have physical capabilities, you have the level of their personal development, what is their physical health, what is their energy. So the ability to learn often depends on their level of physical development. So for instance, it is useless to teach a patient to transfer from a bed to the wheelchair if they actually have no sufficient upper body strength. You can't teach them to do something if they physically cannot do it, right? You can talk about it, but the thing you need to focus on is building up their physical ability, not teaching them how to do something they physically cannot do. So you have to help them learn psychomotor skills. So for instance, the size of the patient. What is their strength? What is their coordination? What is their sensory acuity? So can they see well? Can they feel well? Can they smell? Can they understand what's around them in order to physically teach them something? Again, what is their energy level? Are they in pain? Are they tired? This is not going to be a good learning environment if they don't have the energy to physically be able to do what you've called them to do. For instance, physical therapy. Your patients will be getting physical therapy by a physical therapist. If the physical therapist walks in and the patient's in pain, they're not going to perform to their ability to give them the strength, right? So you as the nurse need to make sure that they're at a pain level where they can actually participate. What is their physical health? What is their energy? I know I keep repeating myself, but I want you guys to understand this because it's it seems like common sense, but it's something that you're going to realize that you don't actually utilize until understanding it fully. So, learning environment. I want you guys to focus on this because it's something you're going to need in your role play. So what type of learning environment will the patient need? So obviously you want it well lit. If you're anything like me, I need lights on everywhere. My husband gets very frustrated because there's lights on everywhere in our house. Do I forget to turn them off? Yes. But I need a well lit environment in order to learn. I don't do well in a darker setting. Good ventilation. Obviously very important. Appropriate furniture. I love being comfortable when I'm learning something. I don't like, obviously sitting in an uncomfortable chair because I'm not going to learn. I'm focusing on how uncomfortable I am. You have comfortable temperature. I already told you guys that if it's too cold for me, I will not focus on what you're teaching me. You need a good comfortable temperature, and don't be afraid to obviously ask the patient, is it comfortable in here? Is it too hot? Is it too cold? Is it a quiet environment? Again, whether the patient can learn in a loud environment, it's important that you do make a quiet environment, close the door, privacy for the patient, and allow them to really focus on what's going on in the room, not everything else going on around them. Again, I just mentioned privacy. That's obviously important. So the ideal setting helps the patient focus on what we're learning. The The number of people included in patient teaching is also important. So again, you need to keep in mind the learning environment for not only the patient, but the family member that might be in their learning. Are there too many people in the room? Who is it that you really need to teach? And that's who needs to be in the room during your teaching. Make sense? So there's obviously, with everything related to nursing, a process. The nursing process is implemented in pretty much all of nursing. So we're going to kind of briefly go through the different ways that you're going to utilize this process while you're teaching. So I talked to you all about seeing through the patient's eyes. I told you that teaching is so important to be patient-centered. You need to obviously always be including the patient in the teaching. You obviously know that as you become a nurse and more experienced, good ways to teach certain things, but you also have to keep in account, does the patient actually learn that way? What is best for the actual patient? So you need to assess the patient's learning needs. So what are the skills? What information is actually needed for the patient to perform this type of care? And what do they need to understand how this is going to help their health problem? What are the experiences that are going to influence the need to learn? And what information that family members need to know to help support the patient. I did a big project on, I think I've told you guys about adolescents and diabetes. So yes, I want my 17-year-old patient to understand diabetes. I want them to understand how to give themselves insulin, but they're also at a pivotal point in their life where they might not completely understand, and you need to involve the parent in order to help them support the patient. So you also need to understand not only in understanding the patient's learning needs, it's not just the patient, which is solely important, but also who else is going to be of support to them if needed. To be successful in teaching a patient, you need to assess all factors influencing the choice of the actual relevant content. So again, what are the learning needs? What's their motivation to actually learn? What's their ability to learn? What's the environment that you're teaching them in? What are the resources available? And are they illiterate in any certain area that you're going to need to change around your teaching plan? So again, this is pretty much what I just said. Your motivation, your ability, what's the environment, and what are the resources for learning. So as much as you can tell a patient what to learn, you also need to provide them with information, like some handouts, some community resources. Those are other ways to teach a patient so that when they leave your care, they're not out there on their own just going by what you said, which is very important, but what are some things that they can refer to? What are some people that they can reach out to? Community is very important with new illnesses. So it's important that you keep that in mind. So we're still talking about, again, I talked about health literacy. What do they actually know? So again, it says health literacy includes the patient's readings and mathematical skills. What is their comprehension level? What is their decision-making and functioning skills in regard to their actually health care? So you need to think through these things before teaching a patient and be able to talk with them about where they are at in a learning environment. Where are they in being able to understand information? Some things to think about: elderly, minorities, immigrants, persons of low income, and people with chronic mental or physical health conditions are at greatest risk for low health literacy. You also have, I told you that you can give people handouts and information. So they actually range from different levels of education. So you can print out information from a elementary school level to a college reading level. And these are things that you need to be aware of for your patient for them to better understand. And also you need to remember cultural implications. You need to remember language barriers. At my job, we can print out health education and patient education in different languages because that's the best way for them to learn. If they speak Spanish and I give them English, they're not going to, I could tell them via my translator what to do, but they won't remember because they're in a state of a different mind. You need to teach them now, but also remember that they're going to need something to refer to. So what are some nursing diagnoses for patient care? These are things I want you to read through. See how you can understand how they will actually be utilized in education. We know that nursing diagnoses are important, so make sure that you kind of can be able to apply these. So you have your planning phase. So you need to determine the goals and expected outcomes that guide the choice of teaching strategies and approaches. So you need to set priorities, select the appropriate timing to teach the patient. You need to have an organized teaching materials, and you can use teamwork and collaboration with families. So you need to include the patient when determining the priorities. Again, patient-centered education. You need to plan teaching activities for a time when the patient's most attentive, when they're most receptive, alert. So for instance, I learn best in the morning. My husband is not a morning person, and it would be better to speak to him and teach him about things in the middle or later day. So you have to understand what is the best timing for the patient. You need to organize the patient's activities to provide time for rest and a teaching-learning interaction. You're not just talking at the patient. There's going to be a lot of communication that happens between you and the patient. It's not just you always talking. Begin instructions with essential content. So if you start with information that the patient already knows, they're going to just block you out and probably not be receptive because they already know this information. So you're going to need to start with stuff that's essential and that they may not know yet. That way you're going to keep their attention. You need to you can identify appropriate health education resources that I talked about. You can use teamwork and collaboration. Again, that means like community resources and ways that they can be in touch with certain people, different resources for them to continue their health journey. Are you all still with me? I hope so. We're almost there, and I hope this has been a little more fun hearing my voice maybe via computer, but keep up the good work. So how do you actually implement this? So you need to maintain the attention and the participation of the learner. Again, we talked about building on existing knowledge. So what does the patient already know? What is the foundation that you can build on? What is you need to select a teaching approach, and you to incorporate teaching with the nursing care of the patient. So active participation is key to learning. You need to have them act. They can't just be, when you teach somebody, you need active participation, not just them staring at you, because if it were me, and we talked about this, you would just think of other things. You need to actively participate in their learning. When you actually have a discussion with your patient or the learner, you need to stay active by changing the tone. I hope I've done well with that. You need to intensify your voice. You're going to make eye contact with the patient. You're not just going to read off a piece of paper. You're going to use gestures that really accentuate the key points of discussion. So right now I'm actually using my hands while talking to you, but you can't see that. But I hope that the tone of voice is changing to keep you engaged in learning. Many nurses find that they're able to teach more effectively while delivering nursing care during like a routine care. So for instance, I think we've mentioned in the past, and you've probably learned that while you're giving the patient, so say you have a patient, again, I'm going to use the diabetes example. So you have a patient that you know is going to be here for a few days. So instead of educating the patient on administering their insulin the hour before they leave, during your care of the patient, why don't you talk with them about what you're doing to administer this medication each day, all day. A lot of the times it's like a sliding scale. So whatever their sugar is at breakfast, lunch, and dinner, you're now giving them insulin 3 times a day. You have 3 different learning opportunities to teach this patient so that it's just a little information at a time rather than a lot of information at once that's overwhelming, because this is a new diagnosis for them. So these are different ways for instructional methods. I'm using this a lot for teaching right now, but again, teaching the patient. So you have group instruction. At our hospital, we do bariatric surgery, and actually every other week they have a group meeting for bariatric surgeries to kind of keep implementing the information, but also giving them other people of resources, other community that have gone through this to allow them to learn. So one-on-one discussion, which you'll probably do a lot in nursing, you and the patient and the family member. Preparatory instruction, what are you going to prepare for the patient? Demonstration, again, demonstrating how to give you a shot of insulin. You can use different analogies. Role playing, which we're going to be implementing, helping them do that. Simulation, that they can actually, again, be a part of the learning process. So more in implementation, you have literacy and other disabilities. So again, you need to know, where is their educational level? Can they hear you okay? Can they see you? Can they verbalize? What are some other disabilities that might keep them from you implementing? Again, we talked about physical needs, spiritual needs, cultural needs, again, cultural diversity, using different teaching tools. We just talked about those. And special needs of children and older adults. Again, you might need to, probably will, of course, need to incorporate the parents in planning education for a child. You can't just teach a child. You need to teach, obviously, the parent as well. Again, we talked about cultural backgrounds, belief systems, what is their ability to actually understand different languages that you may need to overcome. These are all things that you're going to need to think about when actually implementing your education to a patient. So, the evaluation process, which is very important. Again, we've gone through the nursing process, so now we're going to evaluate what we've done. You give a patient pain medication, you don't just never ask them if their pain's better, right? You actually evaluate the pain level just as much as if you educate a patient, you need to evaluate what they've learned. So you need to remember to see through the patient's eyes. Have the learning needs actually been met? Do you need to reinforce correct behavior? Do you need to change any incorrect behavior? This helps educators determine the adequacy of teaching. So if you've taught a patient how to give themselves insulin and they show you what they've learned and they do it wrong, you need to correct the incorrect behavior. And you need to, and again, it's not to tell them that they're wrong, but you need to evaluate that they understand the information. Patient outcomes, so you're legally responsible. Again, we talked about this being in the Nurse Practice Act. You are legally responsible to make sure that the patient outcomes are sufficient for them to better their care. Documentation, which we're also going to talk about on Tuesday. You have to document that you taught the patient, how you taught the patient, and what was the outcome of the teaching. One of my favorite teach-back methods that you'll see, one of my favorite evaluation methods, I should say, is teach-back. So again, you've taught the person how to do this. They need to teach it back to you. So again, the technical term is a closed-loop communication technique that assesses the patient's retention of information during your teaching session. So if you just talk to a patient and educate them, they walk out the door, they have no idea what you just said because of just being overwhelmed. Again, all the factors that go into patient teaching, we want to have them teach it back to us. It's a great method. Teaching back, how do you give your insulin? Show me how you're going to give yourself your blood pressure medicine. How many pills are you going to take? Show me how you're going to change your surgery bandage. Tell me what you're going to look for. I do that a lot with my patients, especially patients that have a different culture and a language barrier, because while I might have the translator there, I don't always know if they're actually taking in the information because it's a third party. So I have them tell the translator what I just taught them. I have my patients face to face say, okay, so tell me how you're going to medicate your child for the fever. And sometimes they look at me with a blank stare, which helps me understand, okay, you don't understand, and you're going to be back here in 6 hours because your child still has a fever, which I don't want for them. I want to make sure that they are competent and knowledgeable in how to care for themselves, their family member, their child, and that's very important as a nurse. You want to evaluate the outcomes. So, 33 minutes of information, just as if we were in class. I hope that you learned a lot. What I want you to understand is that you're going to be implementing this knowledge to show and demonstrate patient teaching. So, kind of get a good grasp. It's not a pass or fail or a grade, but it's just for me to make sure that you understand what you've been taught. See how this works? You can do all of this type of teaching to a patient, to students, to family members, to kids, as a teacher, but you are going to need this information, and I want to really make sure that you understand that to better yourself as a nurse and for you to be the best nurse possible to your patients, because I know you will, because I know you all have compassion, and it's going to be fun. So I hope you guys have had a good weekend, and I will see you all Tuesday.